So we'll go ahead and get started. Today's COVID update, April 20th, 2021. We have a pretty big day of incidents. Over 1,963 of our fellow Coloradans tested positive. We now have 553 people hospitalized. That's the most Coloradans in the hospital with COVID that we've had since the end of January. And that's a significant increase of 43 from yesterday. We also, as we always do, want to take a moment to observe and remember the 6,359 Coloradans that we've lost due to COVID. Everyone, a brother, sister, mother, father, friend, and to the families of those who've lost, please accept my condolences. This is very much a race against the clock. There are Coloradans who have been fully vaccinated, roughly a third of adults. Just over half of adults have gotten at least partway towards the vaccination. And then there's Coloradans that still are entirely susceptible to the deadly virus. For those who have been vaccinated, you can have the confidence of seeing people and moving around, and for you, this pandemic is over. But keep in mind that for the half of Coloradans who haven't been vaccinated, as well as youth under 16 that aren't yet eligible, the pandemic is very much with us. Today what we'll be going over is the amazing impact that the vaccine is having for those who are vaccinated. Really just a strong message to all of us to get vaccinated. We moved, of course, quickly to prioritize the Coloradans that were most likely to be hospitalized and die from COVID, and that's people over 60. Now that we've had 65.2% of people 60 and up fully vaccinated, we'll be able to see the enormous trends. We have less people in their 60s and 70s and 80s than ever before in the hospital, but we have more and more people in the hospital in their 30s and 40s and 50s and 20s, and that's why we're really redoubling our call on all Coloradans to get vaccinated. It's easier than ever before. It's free, it's quick, it's easy. The news that we are announcing today is that we are now taking walk-in or drive-in without appointments at 3 sites across the state. People without appointments can show up at Pueblo County Fairgrounds, 9 a.m. to 5 p.m. They can go to the ranch and just show up Saturday through Friday, 10 a.m. to 6 p.m. and Denver Ball Arena, 9 a.m. to 5 p.m. Monday through Friday. Those are available for walk-in, drive-in. I would also point out that same-day appointments are available at the other sites, at Dick's Sporting Goods, and at many other sites across the state. I should also point out that Mesa County is also taking drive-in or walk-in. So if you're just driving on I-25 by the ranch and just stop off and get vaccinated, shouldn't take more than 15 minutes. If you're there at 5 p.m. or right around rush hour when people get off work, it's open till 6. But there may be a little wait at 5. Maybe it'll take you 40 minutes, but most of the day it'll take 15 minutes. Stop off, get vaccinated. You absolutely, for peace of mind, can set up an appointment so you know when your slot is. COVID19.colorado.gov. Click on vaccine information. There's a list of providers. Plenty of appointments for today, tomorrow, next weekend. Please set one up. Today you're going to learn from Dr. Herlihy that shows the amazing difference that a vaccine makes. I'm proud to report that in Colorado, we're seeing a 93 to 95% reduction in positive cases of COVID among vaccinated people compared to non-vaccinated people. So the vaccines are functioning exactly as advertised. It's not a surprise, but it's really good to see that 93 to 95% level of protection. It's really clear that getting vaccinated minimizes the risk of spreading the virus. And as we've said before, of course, no vaccine is 100% effective. Just to be clear, there's different levels of efficacy. For instance, measles, mumps, rubella is 93% effective against measles. DTaP, which my kids got and your kids got, it's a vaccine. It's 80 to 90% effective against whooping cough. The flu vaccine is 40 to 60% effective. This vaccine, really a triumph of modern science, ranks among the very most effective vaccines. 93 to 95% is really among the most effective vaccines, more effective than even the measles vaccine and really important to get that done. We all want to experience the end of this pandemic, and the sooner that we can achieve the vaccination levels so that the virus has no place to go and no place to spread, the sooner we can turn to absolute normal. And through April and May, of course, working to get Coloradans 16 and up fully vaccinated. It's important that if you're not vaccinated, you get vaccinated, but while that protection is kicking in, because remember, it doesn't kick in until 2 weeks after your second dose of Pfizer or Moderna, or once Johnson & Johnson is back online, hopefully in the next week or so, 15 days after your first and only dose of Johnson & Johnson. Until you are immune, it is very important, more than ever, to wear a mask, avoid gathering with others who are unvaccinated. Be careful. Hospitalizations continue to increase across the country and here in Colorado. I'm going to turn it over to Dr. Herlihy to provide an update on breakthrough cases, how people who have been vaccinated are faring compared to people who haven't been vaccinated, just the cold, hard facts of that from Colorado, so that more Coloradans can see that and make the informed decision to get vaccinated today and not put it off any longer. Dr. Herlihy.
Good afternoon. Thank you, Governor. So as the Governor mentioned, I'm going to share a quick update with all of you on our case and hospitalization trends, and then also share some work that we've been doing to look at these vaccine breakthrough cases that have occurred in Colorado and the high levels of vaccine effectiveness that the Governor mentioned. So this figure shows you our daily case counts. Each of those gray vertical bars is the number of cases that are reported in a single day, and that red line is showing you our overall 7-day moving average trend line. So what you'll see in this trend line is that our rates are high. Our rates have been, in this high level for the last few weeks. They're really as high as they've been since late January in the state. We know that the trends that we're seeing across the state are different really by different region in the state. We are seeing some higher rates of disease transmission in southern Colorado, southwestern Colorado. In other parts of the state, we're starting to see some of the rates come down a little bit. Overall, if you look at the far right end of this figure, you can see that numbers have stabilized in just the last couple of days. I think it's still too soon to know if this trend we're seeing, this stabilization we're seeing in our cases is going to continue. As I said, we are certainly continuing to see an increase in some parts of the state right now. Next slide. So as I've shared previously, this fourth wave of illness is going to look different than our previous waves of illness, and that is due to two things primarily. The first is variants that are more transmissible, causing more severe disease. The second factor is the fact that we have individuals who are fully vaccinated now, and those individuals are protected from disease transmission and hospitalization. So this figure is showing you trends among those under the age of 60 compared to those over the age of 60. And you'll see that we consistently see this growing gap between those two different age groups, where the lowest rates of disease transmission that we're seeing right now are among those 65 plus year olds, where we have a highly vaccinated population. Next slide. Our hospitalization trends, unfortunately, do continue to increase. As the Governor mentioned, we did see a single day increase of 43 hospitalizations today from yesterday. So continuing to see that upward trend here, really not seeing clear signs of stabilization in our hospitalization numbers right now. An important reminder that we are seeing hospitalizations increasing among younger age groups. As the Governor mentioned, we're seeing fewer hospitalizations among older age groups, those that are protected by vaccination right now. But we are seeing, again, hospitalizations among 20, 30, 40, 50-year-olds right now. That's obviously a concerning trend for us in the state. Next slide, please. So next I want to spend a few minutes talking about vaccine breakthrough cases that have occurred in Colorado and talk about the vaccine effectiveness levels that we're measuring right now. And so when I talk about vaccine breakthrough cases, what I'm referring to is the small percentage of people who are fully vaccinated that still get COVID-19 if they are exposed to the virus that causes it. So those are known as vaccine breakthrough cases. Next slide. And so in Colorado, the total number of vaccine breakthrough cases that we have experienced since late January is 819 of those cases. At the same time, 106,965 cases occurred among all people. So you can see here that a very small percentage of the cases that are occurring in the state are occurring among fully vaccinated individuals. Next slide. This figure is showing you specifically hospital admissions that are occurring among breakthrough cases versus all cases in the state. So that red line is showing you the trend among breakthrough individuals, so individuals that were previously vaccinated, then go on to develop infection and then get admitted to the hospital. So what you'll see here is those daily values that are very small, 0, 1 type numbers. And that is in contrast to the hospital admissions numbers that we're seeing among all other cases in the state, where you see numbers in the 40s, 50s, 60s, or 70s per day. Next slide. So we did 2 different analyses to try and look at vaccine effectiveness in the state. The first one is this point-in-time analysis, where we looked at data for the week of April 4th, and we compared the rates of infection that we were seeing among fully vaccinated individuals to the rate of infection that we were seeing among unvaccinated people. And so what you see here among vaccinated people is that during that week, we saw 140 cases occur among vaccinated people. At that time, the vaccinated population was just shy of 1 million people in Colorado. So the overall proportion of cases occurring in that vaccinated population was 0.014%, a very small percentage of the population. That translates to 1 in 7,000 vaccinated people went on to become cases that week. In contrast, if you look at unvaccinated people, that ends up being 9,383 cases that occurred among an unvaccinated population of more than 3.5 million people, for a proportion of 0.258%, or 1 in 387 unvaccinated people went on to become cases that week. Next slide. And so with those 2 numbers, if we put those together as a ratio, what we calculate is that individuals who were fully vaccinated were 94.6% less likely to be reported cases than unvaccinated people. Next slide. Similarly, we did another analysis that looked at cases over time. So this was a cumulative analysis where we were looking at breakthrough cases that occurred since the beginning of vaccination efforts in the state. And here you see 3 different rates of cases that are occurring. So among unvaccinated individuals, you see a case rate of 413.8, and that's based on a 14-day rate per 100,000. You see for partially vaccinated individuals, that's 142.2. And then among fully vaccinated individuals, that rate is much lower at 29.6. And this translates to full vaccination corresponding to an approximately 93% protection against being reported as a case in Colorado. This is very consistent with the numbers that we're seeing nationally for studies that are ongoing in the US, also very consistent with the vaccine effectiveness or efficacy numbers that we've seen from the clinical trials. Again, a reminder about the highly effective nature of this vaccine and the importance for all Coloradans to receive this vaccine. Again, remembering that really vaccination is going to be our ticket out of this pandemic. Thank you.
It's really wonderful to see that the Colorado data is really syncing up with a lot of the national and international data. It's no surprise, but it's really great to see that level of protection here. And I know that'll encourage even more Coloradans to take your turn, get vaccinated. There's a relatively small number of people that don't want the vaccination. For most of you out there, some of you have gotten it. For those of you who've been putting it off, now's the time to get it. Maybe you've thought, hey, I'm 24, I'm healthy, I want to let my elders get it first. Well, guess what? Now it's your turn. Maybe you've thought, oh, it's hard to book. I don't know if I want to spend an hour on the internet. Well, now you don't have to. You just show up and you can get it. It's easier than ever before, and we want to get that message out that you can sign up Centura.org. That's for the Broadmoor and for Dick's Sporting Goods. They even have same-day availability. Or you can just drive up or walk up really anytime during business hours there, Friday through Monday, 9 a.m. to 5 p.m. at Colorado State Fairgrounds in Pueblo. At the ranch near Loveland, 10 a.m. to 6 p.m. Monday through Saturday. As of tomorrow, you don't need an appointment. You can just go. You can also, if you want to, log onto the site and set up an appointment. Ball Arena, Monday through Friday, 9 a.m. to 7 p.m. That's also available for drive-in, walk-in. And then for Dick's Sporting Goods and for Broadmoor World Arena, you go to Centura.org. And you can set up an appointment. You can even do a same day. They have some for today, tomorrow, next week. Very easy to do. As we're gaining ground, I also want to share with you some information about UC Health scheduling. They've now rolled out an open scheduling system for anybody seeking a COVID vaccination can simply log onto their website and sign up. So it had been that UC Health was taking a list and emailing people when it was your turn. Now you can actually sign up online. You don't need to be a UC Health patient, to be clear. And again, it doesn't matter whether they're in network, out of network, or you're uninsured. It's free for everybody. and you can get it at UC Health. You can visit uchealth.org/COVID vaccine. You can call in English 720-462-2255, or in Español 844-945-2508. And Coloradans, if you're already a UC Health patient, you can visit your My Health Connection and schedule an appointment there. But if you're not, you can sign up online. I want to thank Centura, UC Health, major health providers, so many other community health partners and hospitals for really adapting to meet the increased demand for vaccines. And one of the values we have in Colorado is we want people to be treated fairly and equally, and our providers have done an exemplary job making sure that when supply was more limited, that it was done randomly, and then now anybody, both patients, non-patients, in-network, out-of-network, can all set up appointments on their online portal. So thank you to our providers. If you're still having any trouble with this and showing the ranch is too far and Ball's too far and state fairgrounds are too far, or you can't drive there, or you want to find another way to get the vaccine, you can call our toll-free hotline and talk to a real person who can help you find an opportunity to get the vaccine near you. 1-877-CO-VAX-CO. That's 1-877-268-2926. There's also an informational website, cocovidvaccine.org. We are seeing just an amazing change in the difference between, as Dr. Herlihy talked about, 0 or 1 Coloradan per day who's been vaccinated who has to go to the hospital, and 30, 40, 50, 60 who haven't been vaccinated going to the hospital. So there is some strong evidence out there that it not only is about that 93 to 95% efficacy in preventing infection altogether, but there's evidence that, like the flu shot, if you do get COVID, it is a less severe case, less likely to require hospitalization. We don't have all the data to show that that is absolutely the case, but there's a lot of evidence out there that that is the case. And like you, I've been seeing on social media and hearing from younger Coloradans in their 20s, 30s, and 40s who say, "Oh, I'm not going to get mine yet. I want older people to get it." Well, guess what? Now it's your turn. We have enough for you. Show up and get it. You're not just protecting yourself, because yes, this virus can take down perfectly healthy people in their 20s or 30s that are healthy one day and on a ventilator a week later. Absolutely, it has done that. But you are also protecting everybody you come in contact with. And that's why it's important for everybody 16 and up to get vaccinated. And the sooner that we can do that, the sooner we can put this pandemic behind us in Colorado history. I know that the data and science is clear. As you see today, the vaccine is working as it is supposed to here in Colorado. It's absolutely remarkable to see the progress that's being made. The sooner that we want, to be able to go out to large concerts and dances and be arm in arm and together again, we need to reach that herd immunity level. We need to get to that 70-80% range, and it is now available with open doors. You can set up appointments. There's sites you can show up without appointments. Pharmacies across the state all have open appointments as well. Your hospital, community health clinics, our large drive-through sites. We also have the 2 mobile stations that have been, with the temporary absence of Johnson & Johnson, have been repurposed with Pfizer and Moderna. They're publishing their schedules as well, because we know that not every Coloradan lives near another site that makes the vaccine available. So bottom line message, the hospitalizations are up. If you haven't yet been fully vaccinated, please be careful. Wear a mask. Avoid congregating with other unvaccinated people. And please, in the next week or so, get vaccinated. Make a plan in your mind. I'm going to do it on Thursday. I get off work at 3. I'm going to go there at 4 and do it. I'm going to do it on Saturday. Make that plan. You can show up with the drive-in sites with 3-4 people in your car, and you'll all get vaccinated. So it's become a lot easier because of the increased quantity of vaccine that we've been receiving, and we just need that final push to make sure that enough Coloradans protect themselves so that all of us are protected from the deadly virus. With that, we'll be happy to take some questions.
Governor Polis, good afternoon. This is David Clue with Denver 7. I have 2 questions. First, there is a lot of reporting from across the country that many communities are being left with more vaccine doses than they have takers, sort of a vaccine wall, if you will. Where are the supply and demand curves in Colorado, and do we have more than we can deliver?
So the number of people who don't want the vaccine is small. The number of people who aggressively desire the vaccine has largely been reached. So what you're left with is a lot of people in the middle that might put it off, procrastinate, say they'll get it sometime, need to make that decision to get it. So that's that large group in the middle. We're at about 50% of adults who've gotten the first dose, and those who haven't gotten the second will. There's probably 10% or so that don't want it. So that leaves about 40%, putting it off, thought it was hard to schedule, don't want to spend time on the internet. Now that it's available for walk-in, drive-in, easier to get, we're calling for everybody to come out of the shadows and take your turn. No more excuses. It's your turn. When it comes to the flu vaccine, I plead guilty. Some years I get it, some years I don't. I probably got it 2 or 3 years out of the last 10. Why? Because it's just not something I went out of my way to get. If it was there and convenient, I was picking up something in the pharmacy and I saw it, maybe I'd get it. But I certainly wouldn't make a plan around it. This is different. This is an order of magnitude more deadly than the flu. I've lost 2 friends to it. I've had COVID myself. My partner was hospitalized. This is time to stop procrastinating and show up, or make an appointment and show up. Now we do have enough vaccine for everybody.
And on a slightly different topic, Governor, the Dr. Momus Health and Wellness Clinic in Colorado Springs received about 1,500 doses of vaccine despite their inability to refrigerate or store it. Prior to last week, were there no protocols set up to qualify vaccine distribution? And how many other small clinics might there be across the state that are getting vaccines by simply asking for them?
All vaccine providers that we partner with have to attest to meeting certain storage protocols. Based upon an inspection of that facility, those protocols were not met in that case, and that's why corrective action was taken.
Hello, Governor, can you hear me?
Yes?
Gobernador, soy Jesús Carrasquel de Noticias Univisión. Gobernador, sabemos que hay un proyecto de ley para ayudar a los organizadores de eventos. ¿Estaría usted dispuesto a firmar esta ley? Y además, ¿qué ayuda hay para dueños de negocios como salones de fiestas que se han visto impactados por la pandemia?
Sí, cuando esta propuesta llegue a mi escritorio, la firmaré. ¿Algo más?
Hi, Governor. Steger from 9 News. I want to follow up on David's question about Dr. Moma.
Sure.
And there's a clinic in Brighton. You said they have to attest to it beforehand. He asked, how can you assure other small facilities aren't doing the same? I mean, it would seem that these 2 facilities attested to their protocols being right, but weren't inspected until the complaints came in. Like, how do you assure people that there aren't more sites out there like that?
So we have over 1,400 sites across the state, and we do have inspectors that are out there. And whenever there's a reported lapse that's investigated, we also have the ability to do spot checks, which we do randomly on a regular basis. Look, this one was found out because there were reports from people. That things didn't look right. It was investigated. It was found the storage protocols were not met, and it was shut down. Look, I think that the larger scale sites, the hospitals, Centura, UC Health, the Ranch, Dick's Sporting Goods, Ball, Broadmoor World Arena, Colorado State Fairgrounds, these have a very, very high level of medical supervision. And there's been no reports of any issues with those sites. With the other 1,400 partners in getting the vaccine out, they attest to meeting the storage protocols. We do spot checks, and if there's any reports, we're investigated. And I sure hope that there's no other incidences like the Dr. Moma incident, or if there are, that they're much, much smaller. That was a fairly significant number of vaccines where the storage protocols weren't met. Did you have a follow-up?
Mm-hmm. Do you have a specific figure that you're looking at as a benchmark for what you consider herd immunity or broad community protection? What a specific range or number, and then what is the strategy to reach that number after the demand maybe is outstripped by the supply?
Yeah, based on the best public health information we have, we feel that herd immunity number is between 70 and 80% that we need to achieve for the virus to not have enough hosts to freely circulate in our community. And we plan to do that. And we already have 50% of eligible folks who have at least gotten the first shot. Now, of course, we'll be aided in that once the vaccine is approved for ages 12 to 15, which we hope will occur before school returns. Hopefully in the next month or two, the paperwork has already been filed on that. But in the meantime, it's about reaching people who aren't resistant but are hesitant or procrastinating around the vaccine. How do you make it easy? How do you make it convenient? How do you make it quick? How do you make it so you don't have to even go to a website to sign up? How do you make it near where they work or where they commute? Because those who aggressively want it are all but taken care of. And if they haven't, they will be in the next few days. Now we're really trying to reach down to people who, of course, in an abstract way, say they'll get it, but are averse to making those particular plans about getting it. And I get that, because nobody likes to be pricked. And I make a reasonable decision. I don't get the flu vaccine many years. If it's in my face and it's there and it's easy, I will. And for a lot of folks, in an abstract way, they think, okay, I'll get vaccinated against COVID, but they're not going to go online and find it. It's got to be real and easy for them to do.
15 is the idea that they would get their shots at their pediatrician, say, this summer. And then what about the kids under 12?
Yeah. Those, so the under 12, 11 and under, the field trials are underway, but the paperwork hasn't been filed yet. So it's one level behind the 12 to 15. I'm optimistic that 12 to 15 will be given provisional approval before school returns. It's very unlikely that'll be the case for 11 and under. That'll probably be the fall or early winter, but those trials are enlisted and out there, whereas the 12 to 15, the paperwork's already been submitted.
Governor Steve Steger, I did have a follow-up. I apologize, I was muted. You had mentioned the spot checks. Is there any effort by the state to step that up and inspect more facilities and do this on a more regular basis? I hate to nail down on this point, but we're getting a lot of questions from viewers about it.
Yeah, so absolutely. We have inspectors that proactively do checks of sites. I have a high degree of confidence in our partners, and I can certainly assure folks that if there's ever any inadequate storage that is found, anybody who got vaccinated there will be notified, as they were in the Dr. Moma case. And I realize that that's an inconvenience for them. They can be rescheduled and get the vaccination. It's our goal that nobody unwittingly would not have protection when they think they have protection. That's very important, because once they're protected, they may reasonably so, rationally so, let down their guard, not wear a mask, hang out with others. Nobody should be under the false pretense that they are protected. So if they are found out, people will be notified. I have great confidence, especially as we move towards our large-scale sites, the professional pharmacies, the hospitals, the community health clinics, and of course all of our equity partners in helping to make sure that everybody has access to the safe and highly effective vaccines.
Thank you, Governor.
Hi, Governor Seth from the Gazette. A question for both you and Dr. Herlihy. So with this trend of younger and younger people having, making up more hospitalizations, having higher trends in cases, can you talk about what that will mean for this fourth wave and what it sort of means for hopefully the end of the pandemic in the next month or two? Thanks.
Sure. I think, and I'll let Dr. Herlihy, he might want to address this too. My main message is, look, if you're in your 20s, 30s, 40s, quit putting it off, get vaccinated. And if you already have, thank you. And if you haven't, get vaccinated. And until you're fully protected, this pandemic is not over for you, right? The threat may have abated for people who are fully vaccinated, but you are more vulnerable than ever before. Whether you're 26 or 46 and you haven't been vaccinated yet, it's incredibly important with the prevalence of virus in our community to avoid gathering with others who are unvaccinated and to wear a mask. And of course, to sign up and get vaccinated as soon as we can so that A, your life can get back to normal, and B, the pandemic will be over. Let me give it to Dr. Herlihy to address that.
Yeah, I would just reinforce what the governor said in that, I think these hospitalizations that we're seeing among younger individuals are just a reminder to us that we can see severe disease that requires hospitalization among younger populations. And, as the governor was mentioning earlier, our goal is to get to a place of herd immunity, to get to a place where we have population level protection. And there's really just two ways to get there, right? One is through vaccination, and the second way is to get there through, infections through through infection, so immunity through infection. And unfortunately, those infections come with lots of consequences, right? They come with hospitalization, ongoing symptoms, long COVID we talk about, and mortality, of course. And so really the fastest way that we get out of this is to build that herd immunity, and the fastest way to do that is through vaccination without those consequences of hospitalizations, deaths, and long-term consequences of those infections.
And let me say another point to people who might have had COVID at some point. You likely have some increased resistance to COVID, but not nearly the level of that 93 to 95% that the vaccine can get you. So if you had COVID, and especially if you had COVID last year, 6 months ago, 9 months ago, please get vaccinated. We don't want you thinking that you had COVID 6 months ago and therefore you're immune. You're not. Maybe you have some increased resistance. Maybe it's 50 or 60 or 70%, but it's nothing like that 93 to 95%, and it has faded over time, especially if you had it 6 or 9 months ago. So that's another group that's out there where you had COVID, or maybe you even just think you had COVID and you don't know. And we all are guilty of wishful thinking. I got sick 6 months ago. My friend had COVID. I probably did. I never got tested. Therefore, I'm not going to get vaccinated. Bad decision. Get vaccinated, because whether you had it or not, you could get it and go to the hospital and maybe make it and maybe not. So just take that 15 or 20 minutes and get vaccinated. Next question.
Hi, Governor. This is Joe Vaccarelli from Denver 7. Some data from Denver Public Health shows that the Latino or Hispanic population represent only about 13% of people receiving at least one dose of the vaccine, despite making up about 30% of the population and almost half of the COVID cases. And I realize these are Denver numbers, but in the white population received about 70% of the vaccines. What is the state doing specifically to address this disparity?
Yeah, so we have a very deliberate and focused effort on vaccine equity. Over 200 vaccine equity clinics in the parking lot of predominantly black churches with Latino organizations. I was at JBS and Cargill, where we did large employee vaccinations, 80-90% people of color getting vaccinated. So it takes focus, it takes effort. We also have the 2 mobile vaccine stations that we are deployed in underserved communities. So we rely on community partnerships. This morning I was on the phone with the Korean community. We did 2 community clinics with the Korean community. We worked with the Vietnamese community. We've worked with the Japanese community, the refugee community. So these are the kind of partnerships where we make sure it's really about access. Because again, you have people that are medically unserved. They might not have a home hospital. They might not have internet. They might not have the desire or ability to drive a vehicle to a site to get vaccinated. So we do our best to meet them where they are. And we've had over 200 equity clinics across the state.
Hi, Governor Seth, because that again, a quick follow-up. And this again might be better for Dr. Herlihy. Do you think the rise in hospitalizations for this younger group, which generally should fare better against the disease, do you think that's because we're seeing more variants in the state? Do you think that's a driver here?
Yeah, so at this point, we know that more than half of the cases that are occurring in Colorado are due to variants of concern. So these more transmissible variants or variants that can cause more severe disease. And so, yes, it's absolutely likely that variants being transmitted in the state are contributing to increased hospitalization rates and case rates. I think part of the story, though, here, too, is that we would probably be in a very different place with this 4th wave if we didn't have as large of our population vaccinated right now. And so those vaccinations are really suppressing the number of cases that we're seeing and the number of hospitalizations that we're seeing. And so that is why we are seeing the folks that remain are the unvaccinated folks, and that's where we're seeing those hospitalizations occurring.
I would also just wanted to point out that so far the three vaccines, the 2 that are active, the one that will likely return next week, are highly effective against every known variant that we have in Colorado. So I want to make sure people are clear that, and there may be a couple % difference in their effectiveness against different variants, but so far they're effective against every variant we have in Colorado.
Governor John Frank here. We learned just recently that the amount of unemployment fraud was much higher than previously reported. Does that make you regret some of the steps taken to speed payments at the beginning? And separately, do you feel like we should be using stimulus money to help pay down that unemployment debt?
Did you say,
Thank
when you're referring to speed payment, which action are you referring to, John?
The executive order early on to help get those payments out the door to people very quickly, as you noted in a prior press conference, did waive some of the rules.
And you're referring to the unemployment trust fund, right?
Correct. That's for that, yes.
Yeah. So, this pandemic has led to a global recession, which has led to a major spike in unemployment. And that's why it's important that the unemployment insurance that people were paying in, there's many Coloradans that had to be on that for a period of time. The federal government recognized that fact with the CARES Act, the extension of unemployment benefits, now with the American Rescue Plan, extending the additional unemployment benefits. And while most Coloradans are, of course, back to work, there are still some whose jobs have been affected by the decrease in tourism to our state, or perhaps their fear until they were vaccinated of being able to work. Now, hopefully, they're either partially vaccinated or fully vaccinated and able to return to work. I do think it, of course, should be an important priority of the state to make sure that we use the opportunity to deploy one-time funds around shoring up the unemployment trust fund, making sure that we're able to, A, get people back to work sooner, and then B, make sure that that doesn't become a drag on the recovery. And we'll be working on exploring with Republicans and Democrats in the legislature the opportunity to do that. It's one of the things that we heard from many people on our recovery tour that we did, our virtual tour, where we heard from folks about what we should do to recover jobs and grow our economy.
Thank you.
Hi, Governor. Chelsea Brensel with KRDO here. Several Dr. MoMA patients have contacted us saying that they can't get answers to their health-related concerns and questions by health officials here in the state. They say that the county directs them to the state and that the state won't answer their questions. Can you explain why CDPHE isn't answering health-specific questions from these Coloradans?
Well, I don't know what questions they're asking. I mean, the notification that they got was very clear. The state cannot confirm that these were stored correctly. Okay, so we cannot confirm with the normal chain of custody and temperature checks. We cannot confirm that those doses were effective. Therefore, we really strongly recommend that they consider themselves unvaccinated and get vaccinated. There's not much else to say. Is there a chance that they received an active dose that was a first dose? There is, but that's not something anybody should bank on. We don't have the confidence to be able to say, based on the improper storage protocols and the logging of those protocols, that all of those doses were protected. I guess I can go a step further. If I don't know what their questions are, but we have no reason to believe that anybody's health was in any way jeopardized by these vaccinations. The worst case scenario is that they were inert, they were inactive, they did not help. It is possible they were active and fully functional, or some of them were. But again, without knowing that, the best advice for anybody is simply to start your vaccination process over again. Was there any other kind of question I can help, or were those the kinds of questions they were asking?
You know, they had specific questions related to just concerns with getting a third dose. There's not a lot of studies on that. So is there somewhere that we can direct them to that the state can answer any of those more specific individual questions?
Yes, I think we can. Why don't we, is there a CDPHE, what's the best place for them to go to? We'll follow up with you to get you the contact for that. There's no reason that anybody should have concerns about additional doses. In fact, it's very likely that most Coloradans at some point will need a booster dose, perhaps customized to particular variants. That's all TBD. But just as we receive the flu vaccine every year, it's quite likely that fully vaccinated Coloradans might need an additional vaccine in a year or 6 months or 2 years. And it really shouldn't be a cause for concern.
Thank you, Governor.
Hi, Governor. It's Jesse at the Colorado Sun. 2 questions for you and Dr. Herlihy. One, the decision to let these sites be walk-in sites, is that indicative of the fact that we're kind of reaching that point in the vaccination process where there's more people who, or fewer people who want the vaccine than what the state has? And are we kind of needing to get the word out to folks who don't want to be vaccinated? And then Dr. Herlihy, I wanted to fact check a number with you. Can you share what percentage of vaccinated Coloradans, again, have later been reported to the state as testing positive for COVID-19?
So yes, we initially had a lot more demand than supply. Now we have more supply, and there's more demand out there. But I mean, not everybody who hasn't been vaccinated could show up at one site on one day and expect to be vaccinated. It'll still take several weeks to have enough vaccine for everybody who is unvaccinated. But yes, we have been pushing to get to this point of where we no longer need appointments for a while. And we do feel that is a way to drum up interest and increased visitation and increased vaccination at the sites that can support that. So it's not every site in the state. It's not yet at every pharmacy. It will be, it could be mid-May, but there'll be a point in time where you can show up at a pharmacy and get it. You still need an appointment at your pharmacy. But we have reached that point for the ranch, for Ball, for Colorado State Fairgrounds, and in Mesa County. And I think we'll reach it for additional sites in the next week or two, where we are now have enough supply to meet the additional demand of people who don't have appointments and just show up and want to get it. Dr. Herlihy?
Yeah, thank you for the question. It's actually a great question, and it's actually not as easy of a question to answer as you might think, which is why we did two specific analyses to try and answer that question. The reason that it's not a simple question to answer is that the denominator, so the percentage of the population that is vaccinated in the state, is a moving target, right? So as we are seeing the number of people increase who are vaccinated, we have to make adjustments and do a more complex analysis to really try and understand what the rate of breakthrough disease is. And so the first analysis I shared was a point in time analysis where we took a single week in time and estimated what proportion of cases occurred during that week in time, sort of freezing in place what number of Coloradans were vaccinated. And the number I shared at that point was 0.014% of fully vaccinated people became cases that week. The second analysis I did was what we call a person time analysis, and this is really where we use that moving target, and sometimes we move people between the vaccinated, partially vaccinated, and unvaccinated buckets to try and do that more complex analysis. And I'd be happy to talk a little bit more about it offline with you.
This is Gabrielle.
Just on that real quickly. So when she says the partially vaccinated, so that's the after you get your first dose, 2 weeks, and then all the way through 2 weeks after your second dose, because even the day after you get your second dose, you're considered partially vaccinated, right? You only become fully vaccinated 2 weeks after your second dose. So there's a lot of people in that category where there is some protection, and maybe we'll do a subsequent presentation on that. You do, you get some higher level of protection, but not that 93 to 95%. That's the fully vaccinated protection.
Hey there, this is Gabrielle from Fox 31. Just two quick questions, both are for Dr. Herlihy. When it comes to the severity of those breakthrough cases, can you speak a little bit more of that? Were these people completely asymptomatic, or did they have some sort of symptoms? And then also just wanted to ask about different variants that we're seeing popping up around the nation. There's a double mutant variant and now a new Texas variant. Both are reportedly said to be more resistant to antibodies. So which variants are we testing for here in Colorado?
So to your first question, sorry, can you remind me of your first question?
Sure. Just asking about the severity of the cases for the breakthroughs.
Yeah, so that analysis is ongoing in Colorado. What I can share with you is some national estimates. So CDC has shared that approximately 30% of breakthrough cases appear to have been asymptomatic. That's actually higher than the overall national percentage of breakthrough cases, of asymptomatic cases that are reported. That's typically about 15% throughout the pandemic. And so it does appear that we might be seeing a greater percentage of those breakthrough cases being asymptomatic. I think there's still still quite a bit of work, though, to be done to really try and understand the full spectrum of illness associated with those breakthrough cases. Another factor to think about, too, is the fact that we know from the clinical trials that these vaccines tend to be even more effective at preventing severe disease. And so when we see the effectiveness numbers around 90-95% for these vaccines, those numbers are typically higher for the prevention of severe disease and hospitalization. And so we expect that these vaccines are going to be, these breakthrough cases are going to be milder. They're going to be less likely to be hospitalized and less likely to result in death. And then to your second question, which variants are we testing for here in Colorado? So we are doing whole genome sequencing, which means that we are analyzing the full genome of these viruses that we are identifying in the state. And so we are able to identify any of these variants because we're looking at that full sequence. So we're really looking for all variants that are known and have been identified, and really checking what these sequences that we're seeing are compared to what's being seen nationally and internationally.
Thank you all for joining us. And remember, especially if you haven't been vaccinated yet, wear a mask, avoid gathering with others who aren't vaccinated, especially indoors. Small groups outdoors is safer. And please, there's no more excuses. Get vaccinated. It's free, quick, and easy at multiple sites across the state. Thank you.